The topic of this video is penis elongation. I will be explaining the thickening in another video. Everyone thinks that elongation is the main surgery. They say, oh my god, they cut the suspensory ligament, this is horrible. It's not like that. Main surgery is thickening. Cutting the suspensory ligament is much easier. Process thickening. I will explain the reason why. First, I want to check the text because I don't want to skip anything out. First of all, there are some facts about this surgery, and I will explain them in an order. First, penis elongation is performed on the dorsum and the base of the penis because you have to cut the suspensory ligament. I am emphasizing on that. There will be no elongation without cutting the suspensory ligament. If you perform an elongation surgery, you have to cut the suspensory ligament. If you do not, there will be no elongation. I have heard so many weird things about it. We elongate the penis without cutting the suspensory ligament. We do it underside of the penis, etc., etc. I'm trying to be nice and saying that it is utter nonsense. There will be no elongation without cutting the suspensory ligament. This is the fact, and I can say this over and over again. You don't need to be afraid of cutting the suspensory ligament that much. It will not harm the penis in any way. This is also a fact. It will damage the erection, penis will be saggy, etc., etc. These are really absurd. Doctors who say those know nothing about this surgery. I cannot say it more clearly. Cutting the suspensory ligament will not harm or damage the erection whatsoever. If someone says that it causes erectile dysfunction, they should immediately open up an anatomy book and read about this, because this means they do not know their anatomy. It also will not cause any complication. Everyone says that there will be some complication, erection will be damaged and penis will look saggy. These are not true. If someone has saggy penis after having their suspensory ligament cut, I want them to come to me, because this is not possible. Between 2004 and 2006, I've been performing the classical method and cutting the suspensory ligament completely. None of them had any problem with it. I also have a friend who performs this classical method. We sometimes talk about this and says that he has never seen such a case. This never happens, so please don't worry about it. This is for my fellow surgeons. This is an extremely easy and safe method, and it doesn't cause any complication. If anyone says that it has complications, I can make sure that they have never performed such an operation. I have cut the suspensory ligament, and now the penis looks saggy, and it caused an erectile dysfunction. If that happened, this means that you had done something wrong. This is a clear fact. And there is also another thing, elongation the penis from underside. Some surgeons say that they do it and we don't cut the suspensory ligament. Unbelievable. This is not possible. This is a lie just to allure the patients. This is utterly a lie. If they say they elongate it under the penis, it can only be an elongation of the penoscrotal web. Fixing the penoscrotal web is not an elongation method. This is also a fact. Penoscrotal web is a small second that is between the glands and the testicles. So what does it do? If the patient has this, penis will have a hard time when penetrating the vagina. Fixing that can cause the penis look longer because you remove that extra second, but it won't help the elongation, not even a centimeter, because this is not an elongation method. This is also a fact. But they say some stuff to allure the patients, like we don't cut the suspensory ligament and elongate it under the penis. Really? If there is an article about this, send it over to me immediately, because I want to see that too. If you Google penis elongations from underside, you won't find anything on foreign sites. This lie is only being said in our country. Then there's also another issue, removing the fat at the base of the penis. People think that the penis will elongate when it is removed. A patient comes to me saying that he wants that fat to be removed. This is a totally nonsense request. You may want to get rid of your belly fat. For example, one woman wants this to look skinnier. But why on earth would you want to get rid of the penis fat that stays in your underwear? They come to me and request this operation. I insist a bit, saying there will be no elongation with that operation. If you expect that, you will be disappointed. If you want an elongation, you have to be clear on that. After all, I am a doctor. I will heal your problem. When insisting a bit, patient starts to talk and say, okay, so if it doesn't help the elongation, let's do it properly. So removing the fat around the penis will not elongate the penis. It will help the elongation because you will be suppressing the peripheral tissue. But it will not cause an elongation by itself. It is not possible. A lot of patients come to me requesting this. We must say that it will not cause an elongation without cutting the suspensory ligament. Other than that, I want to talk about the classical technique of the penile surgery. We cut the suspensory ligament, separate the penis from the bone, and elongate the penile skin with Z or V Y plasty. This is our technique. One of the classical features of it is cutting the suspensory ligament completely. This way, penis will have no bond with the bone itself. I do a little bit differently. So, what is my modification? I don't cut it 100%, I leave 20% of it. Why? Because what causes the elongation is the connective tissues that we enter from top and open 80%. When we do that, we free that part from the bone and moves forward. This causes the elongation. Freeing the lower part of that connective tissue completely does not cause an extra elongation. Actually, it doesn't help it at all. And I think that the intercourse becomes a kind of trauma because the penis goes inside and outside of vagina. It would be better if it supports with the bone. So I don't cut the suspensory ligament completely. I leave 20% intact because that part will not cause the elongation, and since it supports the bone during the penetration, it helps a little bit more. There is also another issue. Even if you cut it completely, it won't cause the penis look saggy, because everybody is scared of. And when you cut it completely, of course, I'm talking in theory because I've never seen such a case, never heard of it. If you separate the penile tissue from the bone completely, it will be traumatic because it will go inside and outside of the vagina during intercourse. It can go back through the base of the pelvis. What happens then? Penis gets shorter. Because when you cut the connective tissue completely, it has no connection with anything. This is the reason I don't cut the connective tissue completely, because it helps the penis to stay connected to the bone a little bit. And that is the base of the suspensory ligament, but only 20% of it. If you cut it, it doesn't have the elongation. So since it backs the penis up during intercourse, I'll leave it. This is my modification technique. Besides that, I think that intercourse is a kind of traumatic for the penis, because penis is mobile during sexual intercourse and not the vagina. I once watched a documentary about polar bears. Polar bears have a bone inside their penises, like most of the animals, and the documentary They say that when the polar bear is having an intercourse, it sometimes takes too long, like a week or so, and the bone inside of the penis breaks after the intercourse. He has sex, then his bone breaks, and his life is ruined. This is an extreme example, but I think this is also a proof that intercourse is a traumatic thing for men. So we must leave 20% of the suspensory ligament all the time. This is my opinion, and I've been doing it like that for a long time. Is cutting the suspensory ligament riskier? No, it isn't. I've explained it before. It doesn't cause an erectile dysfunction. There is a small vein at the bottom. It goes through the suspensory ligament. We start to cut from the top. There is no problem until we reach the bottom, because there is nothing inside. It is just a connective tissue. When we get closer to the base, bleeding starts at some point, because we cut that small vein that is inside. Then we cauterize it to stop the bleeding. This procedure is not harmful, and it shows that we are getting close to that 20% part. The vein is towards the bottom, and when you cut it, you cauterize and stop the bleeding, because it is a vein and not an artery. Other than the vein, there is nothing inside. So it won't cause any loss of sensation or erectile dysfunction, and the penis does not look saggy. Suspensory ligament surgery is completely safe, and it doesn't have any complications. You don't need to worry about it, and it is really easy to find it. It is still tissue that anchors the penis at the midline, and it anchors the pelvis at the back. If you pull the penis forward and press at the base, you can feel it. It is really stiff and feels like a piano string. It is also quite easy to find. You cannot hurt any other tissue while cutting it. Other tissues are way softer than it, so you can feel the difference. Sometimes we are having a hard time performing this surgery. We could not find any retractor to pull the penile tissue forward, because this type of retractors are not included in any set. We checked the foreign catalogs and seen that there is not a proper retractor for this surgery. Then 8 or 10 years ago, I have had this retractor made. It is just the right size for the penis, and it helps us to pull the penis out. I've been using this. I've named it idil penile retractor. I must say that it is really useful and for this type of surgeries. Connective tissues is cut very easily because of it, and it also helps us pull the penis forward thoroughly, since it fits the penis perfectly. This surgical instrument has increased this surgery's effectiveness so much, and since then I've been using it, and I am the only one who has it. Besides that, what is the basic logic of this operation? I will explain it too. The logic of penile elongation is that moving the corpus out and pressing the peripheral tissue as much as possible. When we move the corpus out and press the peripheral tissue to the base, elongation will be way much better. In order to do that, you have to cut the suspensory ligament to be able to move the penile tissue forward. You need to free it from the bone. So, if some doctors say that they perform the elongation surgery without cutting the suspensory ligament, please do not take them very seriously, because penis will not stick out of if you don't cut the suspensory ligament. This is a clear fact. You can find this in the books as well. You cut the suspensory ligament and move the penis forward, and a gap occurs between penis and pelvis. The book says that you should put a silicone wedge. Anything goes as long as it is silicone. I don't like this method. I close the that gap by suturing the right tissue to the left tissue in order to keep the penis at the front. I close the gap completely and obliterate it. When doing that, we begin to suture from the bottom and continue upwards. Imagine that there are two walls. We close the gap between them by suturing, and penis stays in the front and pelvis stays in the back. Over the years, I've modified this technique. I have put some sutures behind the penis that help to eject it. After separating it from the bone, I put some sutures behind it. These sutures are extremely important. Freeing the penis from the bone is just not sufficient. You have to push it out. But when you do it, places and angles of the sutures are really important. The other day, I was talking to a nurse during the surgery. I said, it took me 10 years to learn to place these sutures correctly. It is seriously crazy. If you exaggerate those sutures just to separate the penis from the bone completely, you will be burying the penis inside. You basically bury it. It even looks shorter. You need to suture so precisely that you will both separate it from the bone and move it forward. This is the only way you can elongate it. You can only learn this by practice. It is really hard to explain, to show where the suture should go. Surgeons learn that only by practice. Besides that, let me check. Removing the fat at the base of the penis. It doesn't cause an elongation by itself. A lot of patients think it does and say that they want to have it removed. Removing the fat at the base of the penis will not cause an elongation, but it helps the penis look better at the elongation surgery, because we move the corpus tissue out, then suppress the peripheral tissue. We need to thin down the area by removing the fat. And we also need to elongate the skin that is at the base of the penis. So how we do that? We either perform Z-plasty or we Y-plasty. It is not very easy for you to understand that, because during the residency you only observe the Z-plasty. They do not allow you to perform it. After observing 2 years, you understand the logic and start to do it. It is not easy thing to explain, but I explain it to my patient in a short and a practical way. For example, let's say this is 10 centimeters long. And we want to increase this distance. You can assume that this is the base of the penis. Since we will be elongating the penis, we will also need to elongate this tissue. In order to that, we make conjugating triangles and interlock them together. So we double the measurement and distance. When the distance was 10 centimeters, it became 20 centimeters. After locking the triangles, we elongate the skin at the base of the penis. But if you pay attention to my movement, you can see that when these triangles interlock, left side gets closer to the right and vice versa. So we take the elasticity from the sides and give it to the length. Basic logic of the Z-plasty is this: we don't add an extra tissue, we just change the direction of the skin's elasticity. We take it from the sides and give it to the length. When we elongate the penis, this procedure helps the base skin to accommodate itself to the elongation. We also need to do this elongation to the base of the penis. If the penile tissue has been moved forward, the skin at the base should also be elongated, or you can suture it, because sutures don't meet. You need to perform either Z or VW plasty. As you can see, the elongation surgery is not detailed one. You need to free the penis from the bone, move the corpus forward, suture the back, and thin down the peripheral tissue. I don't get a lot of questions explaining the thickening surgery will take so much more than this. One of the questions is that under penis or penimaster, these are the instruments that pulls the penis out and helps it elongate. Are these useful or not? The books say that this kind of instruments might be useful for people who has had this surgery. It says might, so it is not guaranteed. Why? Because there isn't any scientific article that was prepared with the distance and measurement. How much under penis affects the penis? Does penimaster helps an extra elongation? We don't know any of it, but it says if a suspensory ligament has been cut, these tools might be useful. So why? Because the suspensory ligament is a stiff tissue. If it is not cut with an elongation surgery, this kind of instrument will hardly become useful. Since the suspensory ligament has not been cut, you cannot separate the penile tissue from the bone. It is a stiff tissue. When we cut it with scissors, it sounds like chat, chat, chat. If you try to use this instrument without the surgery, it would just be a waste of time. After 3 or 4 weeks after the surgery, you can use these instruments because the sutures return to normal position. But this is also an interesting point. A patient of mine called me and said that I bought one of these instruments and it has come out with an instruction pamphlet. I will send you the photo because I want to know your opinions on this. He has sent me the photo. It looks like a small note paper, and on it says this instrument is for the people who haven't had the surgery. Interesting, isn't it? This instrument cannot help someone who hasn't had the surgery. Interesting. You cannot pull the penis out with this instrument if you haven't cut the suspensory ligament. So why does it say so? I think the company has learned that people who have had the surgery started to use this instrument, and they didn't want to be responsible for any complication, suture problem or bleeding, so they put the pamphlet which says this is for the people who haven't had the surgery. They just didn't want to deal with any legal issues. I think this is the reason for that. For example, cotton buds that are sold in the market have a warning on it. Like, do not put into your ear. I don't know how you can use it without putting into your ear. They just want to be on the safe side. Someone can perforate their eardrum, and we do not want to be responsible for it. So they write that. How on earth can you use it without putting it into your ear? So these instruments won't be effective on the people who have not had any surgery. But probably the company wants to protect themselves and does not want any responsibility. So they put that writing on it. I think it is silly. Some coffee shops have cups that says, "Be careful, it is hot." So it is something like that. Will the elongation be visible during the erection? I have talked about it in the intro video. Some patients say that it is visible when it is soft and also when it is on erection. And some say that it is only visible when it is soft, not when it is on erection. This is an important point because I don't want you to call me and say that it is not visible during erection. There aren't any clear scientific study on that, but feedbacks are like this from the patient. As I've told in the other video, one of my patients has said, "Doctor, it is not very visible during the erection, but it is visible when it is soft. And it is not so important for me that it is visible or not during the erection, because I am busy then." You get it right. I should also say that you cannot see the thickening when the penis is on erection. It can be seen in any case. We are not talking about the elongation. Some patients say that elongation cannot be very visible during the erection. These patients do not usually come for their doctor appointments. They also do not send any photos. This happens everywhere in the world. It is very rare for them to send photos after this type of surgeries. But they say this, so I have to point this out too. Some patients ask if there is any scar left. This issue bothers some patients very much. I want to say this clearly. This is a surgery. Of course, there will be a scar because we cut the skin. When we perform the suspensory ligament surgery, we have to cut it. But if we only do the thickening, there won't be any scars usually because we do it with the cannulas. We take the fat from the abdomen and again use the cannulas when we inject that fat. There won't be any scars. But if we are performing the elongation surgery, there will be definitely be scar at the base of the penis. I perform Y-plasty. It leaves a reverse Y mark at the base. This scar sometimes is quite visible in some patients, but in some patients it is quite faint. I have had some patient who has had a visible scar. There are not so many, but after our cosmetic revision, it has started to look like a hypertrophic scar. Some patients leave hair on it. I have opened the dressing today. The sutures look really awful. When we suture on that area, we blister the tissue. When the scar tissue starts to heal, it softens and subsides. We do it that way because we know how it will go. It looks bad in the beginning, but after the healing process, like 6 months later or so, you will see that it is equal to the peripheral tissue and the mark will be very fair. If we do it equal to the peripheral tissue in the beginning, and the patients call that gluing. If we do it that way, when the suture subsides, after a while, it will leave a mark that looks like a small cavity. We know that, so we blister the tissue while the suture it, and this is called the everted suture. This is a special suture technique. We do it on purpose. If you Google it, I'm sure you will find a lot of stuff on that. You can find the explanation there because this suture needs to be that way. Besides that, we always do this with lateral suture. Since we do it that way, we don't need to remove that. Patients open the dressing on the 3rd day, take a shower, then leave the suture like that. They use antibiotics for 5 days, then they won't need any dressing or antibiotics after that. Sutures have a few knots on them. They fall off in 3 weeks. I don't have so many things to say about elongation. This is almost all I can say. Although it is an extremely safe procedure, some of the plastic surgeons are scared of it and they lie to the patients who are also scared of it. They try to allure them saying, we don't cut the suspensory ligament and still do the elongation. Sadly, some patients believe them, then they get very disappointed because there won't be even a millimeter elongation. Please inform yourself on this subject. I say this both for the doctors and the patient. There is no such things as elongations from the underside of the penis. You have to enter from the back of the penis, then cut the suspensory ligament. There is no other way around. Full stop. This is all I can say. This is the end of my video. You will see the phone numbers and addresses at the end of the video. If you have any question, you can email me. I will get back to you. So I should start my video on penile thickening. I hope you watched that too. Bye.